One of the medical areas in which the laser has had a substantial impact is in ophthalmology, which deals with the structure, function, and diseases of the eye. Section 2610 discusses the human eye and the use of contact lenses and eyeglasses to correct nearsightedness and farsightedness. In these conditions, the eye cannot refract light properly and produces blurred images on the retina. A laser-based procedure known as photorefractive keratectomy, or PRK, offers an alternative treatment for nearsightedness and farsightedness that does not rely on lenses. It involves the use of a laser to remove small amounts of tissue from the cornea of the eye and thereby change its curvature. Light enters the eye through the cornea, and it is at the air-cornea boundary that most of the refraction of the light occurs. Therefore, changing the curvature at that boundary can correct deficiencies in the way the eye refracts light, thus causing the image to be focused onto the retina where it belongs. Ideally, the cornea is dome-shaped. If the dome is too steep, however, the rays of light are focused in front of the retina and nearsightedness results. As shown here, the laser light removes tissue from the center of the cornea, thereby flattening it and increasing the eye's effective focal length. On the other hand, if the shape of the cornea is too flat, light rays would come to a focus behind the retina if they could, and farsightedness occurs. In this case, the center of the cornea is masked and the laser is used to remove peripheral tissue. This steepens the shape of the cornea, thereby shortening the eye's effective focal length and allowing rays to be focused on the retina. The laser-assisted in situ keratomileusis, or LASIK procedure, uses a motor-powered blade called a microkeratome to detach a thin flap of about 0.2 millimeters thick in the front of the cornea. The flap is pulled back, and the laser beam then remodels the corneal tissue underneath by vaporizing cells. Afterward, the flap is folded back into place with no stitches being required. In this case, a sophisticated shaping of the cornea can be accomplished, correcting for other more complex light focusing problems such as astigmatism. The laser light in the PRK and LASIK techniques is pulsed and comes from an ultraviolet excimer laser that produces a wavelength of 193 nanometers, which is in the ultraviolet region of the spectrum. The cornea absorbs this wavelength extremely well, so that weak pulses can be used, leading to highly precise and controllable removal of corneal tissue. Typically, 0.1 to 0.5 micrometers of tissue is removed by each pulse without damaging adjacent layers. The laser finds its way into many other medical applications, including laser-initiated drug release. In the treatment of cancer, the laser is being used along with light-activated drugs in photodynamic therapy. The procedure involves administering the drug intravenously so that the tumor can absorb it from the bloodstream, the advantage being that the drug is then located right near the cancer cells. When the drug is activated by laser light, a chemical reaction ensues that disintegrates the cancer cells and the small blood vessels that feed them. Other laser applications include the laser scalpel, which can be used to ablate or cauterize tissue, laser lithotripsy, used to break up hard masses like kidney stones. Lasers are employed in dental procedures, including oral surgery. They are used in plastic surgery and in laser mammography to screen for breast cancer. The applications in the medical field alone are endless, and the invention of the laser has had a great impact on the world.